Hello everyone, welcome to fifth video of NEET-PG 2024 recall questions discussion. Here one fruit farmer presented with fever and body ache, and there is history of frequent bat visit in his farm. So as you can see in this image, there is one bat in his farm. So fever, body ache with exposure to bat, the most probably the infection is Nipah virus, because Nipah virus is commonly associated with exposure to bat and eaten of fruits, uh, and presenting manifestation may be fever, body ache, malaise, even encephalitis, etc. A 26 years old lady presented at 27 weeks pregnancy, who is found to have a fetus having many congenital anomalies. They requested a doctor for medical termination of pregnancy, for which court suggested a formation of a medical board. Who among them is not a member of this team, medical board team for MTP, whether it is pediatrician, gynecologist, lawyer, and advocate? This question, what is your opinion? Kindly let me know in the comment section. A patient suffered shaft of femur fracture, was being treated for the same, so shaft of femur fracture, and the patient prosthesis used is shown in this image. So this is nothing but dynamic hip screw. So this is DHS or dynamic hip screw. Coming to question number 44, patient with hematuria flank pain subjected to renal histopathology, which yielded the following image. This image shows large pale cells. As you can see, there are so many large pale cells with resinoid nucleus and perinuclear halo. So these large pale cells with resinoid nucleus, perinuclear halo, and reticulate cytoplasm is characteristic of chromophobe type of RCC. So this is chromophobe RCC. This histological picture is suggestive of chromophobe RCC. A patient developed high-grade fever with neck rigidity. CSF examination showing gram-negative diplococci. She has had recurrent infection in past, so there may be some immunocompromised state. So identification of etiology. So Neisseria infection is much more common in C5 to C8 deficiency. In this disorder, bacterium is very common, especially with gram-negative diplococci like Neisseria gonorrhoeae or Neisseria meningitidis, and toxoplasma infection is also common. So, and C1 esterase inhibitor causes hereditary angioedema. C1q associated with severe combined variable immunodeficiency. C24 SLE. C3 with pyogenic infection, C5 with impaired chemotaxis. Our question was about gram-negative diplococci. It is associated with C5 to C8 membrane attack complex deficiency causing bacteremia and infection with gram-negative diplococci like Neisseria. So the answer is Neisseria with C5b to 9 deficiency. A child with perianal itching, mother noticed some thread-like structures in underwear. The egg analysis suggested eggs as shown. So this image was given this type. So this is plano-convex. This is plano-convex or D-shaped egg, characteristic of, yes, this is Enterobius vermicularis. So the answer is Enterobius vermicularis, plano-convex or D-shaped egg. 47. This type of injuries are found in, here you can see there is multiple bleeding spot just below the leaf, in the inner surface of the leaves, when there is pressure over this region, like in the mechanism like smothering. So in smothering, due to application of pressure over the mouth and nasal orifice, there can be mucosal bleeding. So this is picture suggestive of smothering. Question number 48. A child came with perianal tenderness and swelling after a suspected sexual assault. A test is done and following is observed. So this test, here you can see the yellow needle shaped crystal. So these are the crystals of spermine picrate. So these are crystals of spermine picrate, yellow needle shaped crystal. This is test is actually Barberio test. checks for spermine. There is another test of seminal fluid, that is Florence test. In Florence test, it test actually checks for choline, and the needle should be rhomboid shaped. But here needle shaped crystal is seen, so it is nothing but spermine. So this is Barberio test, checks for spermine. Coming to question number 49, lipid profile of a patient showing increased triglyceride LDL with multiple xanthoma all over the body and tendon xanthoma. What is the underlying defect? It can be LDL receptor defect type 2 hyperlipoproteinemia. So multiple tendon xanthoma and soft tissue xanthoma with increased triglyceride LDL, it is suggestive of type 2 hyperlipoproteinemia. Question number 50, this is endoscopic view of a chronic alcoholic patient. Here you can see some engorged vein. So bluish color, some engorged structure on the wall of the GI tract. So this is esophagus. So these are nothing but esophageal varices. So in the next video we are going to discuss question number 51 to 60. So stay tuned and subscribe the channel. Thank you very much for your attention.